Okay, this is Dunbar T. He's been a patient of Dr. Rehrig's for some time, and he has a few words to say.
I originally came here. I actually interviewed Dr. Rehrig and his wife, Doreen, on the phone. I was looking for a doctor that was not interested in operating, not interested in over-medicating, someone who was sincerely going to help me with my health. Because I had recently had a collapsed lung, and I don't know how I got it, or the doctors couldn't tell me why it happened. So as I researched and researched and researched on my own while I was in the hospital, because they were threatening me with surgery and medication, and I was resistant to everything. All right, the only thing I had to do, they put an incision in my chest and put a tube in to release the air, and by law, they had to keep me under observation for 72 hours, 3 days. And after that, they had to take the tube out and keep me under observation for another 72 days to make sure there was not a reoccurrence. I was done, because the entire time I was in the hospital, I felt like I was like in prison. You know, they kept trying to get me to take medications I didn't want, surgeries I didn't want. So while I was in the hospital, I researched my condition, found out that my body was dehydrated, and that caused my lungs to collapse due to blisters that formed on the lungs and burst. So I did my research, and I looked around for someone who could literally help heal my body, all right, without medication. And I interviewed Doreen on the phone, and I came in. We talked. Dr. Rehrig, he interviews you once you get here, and we developed a really good, solid relationship. Within about, I would say, 6 months, I felt normal. I felt like my health was improving. And through and I think this was even before they had the nutrition program. So I was one of the first inductees into the nutrition program. And that took me to another level of health, because I really liked his philosophy about the mind, the body, and the spirit. You know, it's the triangle that encompasses a human being. And I've lived by that, and it works for me. And when I don't come here, I start feeling bad. I have to come back. I mean, you have to come back because you know what it takes for your body to feel good. And the therapy that you get here, the chiropractic care, the nutritional program, and Dr. Rehrig calls it the software treatments, which is the therapeutic massage. It all works, and it's a great thing. And it's really changed my life, and I feel better. I don't know if, I'll tell you, I'm 55 years old. I'm going to be 56, but I don't feel like it. I still feel like I'm in my 30s.
And you do look marvelous. Thank you so much, Dunbar. We appreciate it.
Okay.